This is a post by 50 Shades of Gay official, and it's about the first sex reassignment surgery in 1971. A 24-year-old named Shona, so it's a pseudonym, in the late 60s, she approached Professor S.S. Ratnam, who you might have seen before in some other videos about obstetrics and gynecology in Singapore. He was a very well-known ONG in the 70s and the 80s up to the 90s as well. Ratnam had no history of gender surgery. So remember, he's an obstetrician. So his specialty is women's health and female reproductive organs. And whatever other medical knowledge would be the level of all physicians who go through medical education. She asked him directly for an operation that barely existed as a medical category in Singapore. She did not stop at one conversation. She kept returning, kept asking, until the doctor himself found himself pulled into a new kind of medicine, i.e. gender medicine. This post is framing Shona as like she worked hard, right? She kept trying to get what she wanted or needed, and that's something that we should admire in her for doing. She kept asking. But Ranam had no local precedent to draw from, so he went looking elsewhere, studying surgical literature and adapting techniques that had never been performed in this part of the world. There was no professional safety net and no guarantee that Singapore's medical establishment or its government would stand behind him. He decided to operate anyway. Here it's framed like he was doing something brave, but honestly, I'm thinking like this is a cosmetic surgery and he had never done this before. Isn't this considered experimental? The news article, 1971, I think it doesn't describe what the operation was. When I was reading this, I thought, is this penile amputation? Is it penile inversion? Is it just removal of testicles, also known as orchiectomy? It was just described as a great success. First operation of its kind to be performed here. The patient felt that he was a fixed female. However, here it is described that Shona is a 24-year-old man. And Kanakaba Hospital is a maternity hospital. So normally a man would not ever enter this hospital for anything. That's the article that was in 1971 about the first sex change surgery. You can read about that. There's also a cop went for a sex change operation. Private hospitals also started to do it in 1990. Women also wanted to undergo the operation. So let's see, for the women that wanted to do an operation, this article actually describes what that operation entails. Okay, because activists will use the euphemism bottom surgery or top surgery, but it doesn't actually say what the surgery is. Dr. Ratnam was in charge of this operation, believed to be the first performed on a woman in Southeast Asia. Let's see the date. This was 1975, so 4 years after that first one. The first patient who had this done had a tube-shaped appendage of fat and skin sliced off from her waistline. This appendage was then grafted back to the waistline to provide blood supply. And once the tissue can be seen to have a blood supply, the appendage is detached from the waistline and then transferred towards, I think, the mons pubis. The final stage, a tube is made inside the appendage to allow the passage of urine. However, they do acknowledge that these are just non-functional organs and you cannot reproduce with them. I was trying to look for what this sex reassignment surgery actually entailed. Like, what did Dr. Ranam actually do? I found this study dating from 1981. Here you can see the doctor's names. And it's talking about the recovery of the testicular function after using opposite sex hormones. So the study looked at 21 male transsexuals who had been on steroid hormone therapy for at least 1 year. So they were taking estrogen for at least 1 year. The sex reassignment operation, this includes castration, removal of testicles, venectomy, amputation of the penis, and construction of an artificial vagina, meaning a cavity in their perineum between the testicles and the anus. Of course, this cavity does not exist in men. So how do they create that? Obviously, I cannot show it on YouTube. So you can Google, look at Reddit. Now let's look at the other news articles first. Here's another one about Shona. So Shona, sort of the history of Shona, was the eldest son in a family of 5. As a child, he was dressed as a girl by her grandmother. By the time she attended the gender identity clinic, she had a group of friends who used to hang out at Bugis Street. And we see in the Instagram post, they show pictures of the night scene at Bugis Street. At that time, it was very well known since the 1950s for a place of gathering of men who identified as trans. And this drew a lot of attention and tourists, sailors, and so on. Shauna's first sexual encounter was with a man at a party. She also worked as a maid in a European man's house and had an affair with him. She later joined a cabaret, became a part-time model, entered a beauty contest. By the time she came to the gender clinic, she had been cross-dressing and living as a woman for some time, and also previously had tried to commit suicide. Her sex change operation made medical history in Singapore and the region. Also saying that it caused a change in the law. 1973, Ratnam pushed the government to act. In 1973, Singapore agreed to let transgender people who had gone through operations change the sex recorded on their identity cards, only the identity cards. And this post considers that very significant. Here I found an article from 1991. Says sex change pairs cannot marry. A person's sex is fixed at birth in the eyes of the law. The Judicial Commissioner K.S. Raja judged the Lim versus Hyok case, a first case of a transsexual marriage. He explained that a transsexual can never run away from his or her biological sex, despite undergoing a sex change operation and having the new status reflected on the identity card. Because of this, he declared the marriage of Lim to her sex change husband Hyok null and void, on the basis that they were both female. In the name of common sense, desirability, certainty, and consistency, the English matrimonial and criminal courts have followed the decision in Corbett's case, both in marriages and criminal cases. A person biologically a female with an artificial penis after surgery and psychologically a male must, for the purposes of contracting a marriage under the Women's Charter, be regarded as a woman. Legal experts said that Mr. Raja's decision was controversial since the ROM had implicitly allowed such marriages since the first sex change operation in 1971. So before they registered the marriage, so after 1971, they just looked at the identity cards because the people who had a sex change could have their identity cards sex status changed. But now ROM says they will check their birth certificates. Later on in 1992, Mount Elizabeth Hospital decided to stop all sex change operations. Since 1971, 500 sex change operations were done in Singapore. And Singapore was acknowledged as one of the major centers for such surgery. Wow, in the 80s and 90s. This is 1992, so only NUH still carried out these operations and they were scaling down. Mount Elizabeth, a private hospital, has decided to stop or discourage operations, or decided to stop altogether because of its fear that some of its patients could have AIDS. Mount Elizabeth also said the ambiguity over the legal status of transsexuals led it to stop. The law itself does not recognize the new sex status. You could change the identity card, but this is a change of form, not substance. They say that this is a resource-scarce medical world, so such surgeries are not ranked high on the scale of priorities. The Health Ministry appears to describe this position as it says that it stops such operations on foreigners as these are not life-saving procedures. Allocation of resources is a fact of life. By accepting this does not mean that the ministry should decide not only how government health resources are to be utilized, but also those from the private sector as well. Here's a study from 2010, and this concern about the HIV in transsexuals. So again, we see Dr. Ratnam is here and his colleagues. So they looked at 154 male transsexuals and 123 female transsexuals who were requesting SRS at NUH. They also took their blood and tested them for HIV antibodies. None of the female transsexuals were engaged in prostitution. 9% of the male transsexuals were engaged in prostitution. Most of the females were sexually inactive, about half of them. Whereas only 10% of the males were sexually inactive. So they discussed some of the sexual behavior and practices of these patients in the article, and they concluded that more of the males were sexually active, had earlier sexual contact, engaged more often in intercourse, had 7 or more sexual partners. However, none of the 200 plus, almost 300 patients that they studied were positive for HIV antibodies. Here's also another article from 1990. They were very concerned. I guess this is a time when a lot of surgeries were being done at public and private hospitals in Singapore. They wanted to look at the developmental profile of 200 male and 100 female transsexuals in Singapore. Transsexuals started a psychosexual development earlier than controls. The feeling started in childhood. Male transsexuals went through a homosexual phase followed by a transvestite phase before they became transsexual. This means that they had their first sexual contact with a man and then transvestite. So they started cross-dressing, dressing in women's clothes, wearing makeup, and then they developed a transsexual identity. Whereas female transsexuals did not go through such distinct phases. Cross-dressing was one of the early signs of transsexualism and started earlier in females. None of them were married. Contrasted to another study that showed that 50% of Caucasian transsexuals had been married. This argument from 1990, or at least this study, is consistent with the argument in this book called The Transsexual Empire. The Making of the Female, a fascinating look at transsexual operations and the cures they promise, by Janice Raymond. I think you can probably also find a PDF of this online. The main argument here is that, so she argues that there were two kinds of male transsexuals, one being homosexual, so being gay, and also feminine. They decide to try and pass as women because straight women are more socially acceptable than homosexual men. And the other category of male transsexuals are autogynephiles, so men who have paraphilia for thinking themselves as being women. So by dressing up and imagining themselves as women, they gain sexual satisfaction. Whereas for females, those who transition, here's a really good book, Irreversible Damage, The Transgender Craze Seducing Our Daughters by Abigail Shrier. So she's looking more at the current trend of why more and more girls are identifying as trans. And she found that due to several reasons, such as sexual trauma at a young age, being autistic and unable to name certain concepts, or feeling discomfort with their bodies, and also being lesbian, and how that is not socially acceptable anymore, and that to adopt a trans identity is more, in trend, and they gain more social validation that way. The book is really good. I've also read it, so you can read that if you want to know more about the transgender craze. Yeah, so going back to the original post by 50 Shades of Gay. By the 1980s, Singapore had become known across the region as a place where the surgery could be done safely and well. A reputation that traced directly back to 24-year-old Shauna, who refused to accept no. And, that's framed as a good thing. And the doctor who decided the unfamiliar was still worth attempting. The country never fully resolved what it felt about the history, but simply kept living with it. As you can see, the surgeries that are done, when I look through the scholarly articles, these are just cosmetic surgeries. So for the males, it's about removing the penis, constructing artificial cavity in the body, removing the testicles. For the females, it's about, using like a skin graft and then grafting what looks like a phallus onto the crotch. So these are just cosmetic surgeries. Even the law recognizes that actually it's just a change of form, not a change of substance. You can change your identity card, but you cannot change your birth certificate. And like what I commented here, I said like he had no experience in such cosmetic surgery. He's an obstetrician by training. So all these are all considered experimental surgeries, and we don't know what was the follow-up with the patients and what is the quality of life when you have such a cosmetic surgery. You have a piece of skin attached to your crotch as a artificial phallus. This is a great Substack. Please read this. Sick. She follows up with various trans-identified people and all the surgeries they go through, and the complications that they face from it is more than 90%. They go through multiple surgeries. Oftentimes, they have to wear a catheter for 6 months or more. So from having healthy genitals, after they go through such cosmetic surgeries, now they can't even urinate properly. So aren't you making somebody who's healthy disabled because of something that they wanted? Yes, they believe that they are, of the opposite sex, but the treatment is to create more health problems for that. So is that worth it? Yeah, somebody accurately said that there have been no more surgeries in Singapore for more than a decade. So I think the post is it seems to suggest that like this occurred in the 70s and things have been going upwards from now, but actually you can see that a lot of hospitals stopped doing this now. I don't know about NUH, whether they do it anymore. It could be worth finding out. But yeah, maybe that's a topic for another video. All right, thanks for watching this one. See you in the next video.